Allergic conjunctivitis or allergy of the eyes is a pretty common condition as well as a pretty annoying condition as well. Let us understand a little bit more about this condition. It is most commonly seen in children, but it can be seen in adults as well. The presentation can be seasonal, that is every season, maybe summer season or rainy season, this episodes can happen, or some people get affected throughout the year as well. Now, what are the symptoms of allergic conjunctivitis? One of the most common symptoms is the urge of rubbing the eyes. So when a child is constantly rubbing the eyes or an adult is constantly rubbing the eyes, it can be one of the most important symptoms of this problem. Second is watery discharge, the eye keeps watering, as well as a ropey discharge, that is a mucoid discharge or a sticky discharge from the eyes. The presentation can be like puffiness around the eyes, a little bit of a different color to the eyes, as well as like hue, we call it as allergic hue, and a little bit of redness as well. So these are the signs and symptoms of allergic conjunctivitis, and it can be associated with cold, cough, sneezing. So if somebody is asthmatic or somebody has allergic dermatitis, that is allergy of the skin, these are the people who are more prone to allergic conjunctivitis. Now, when you come to the doctor after starting antihistaminics or anti-allergics or mild steroids, all these things can definitely bring down the condition, but then this can be temporary if more important thing, that is to avoid the allergens, is not taken care. So today, let us try to understand how can we prevent this allergic conjunctivitis to happen more frequently. How can we decrease the episodes of this problem? For this, there are some common things which we have to remember. First thing is that the condition can be most commonly a result of dust allergy. Second thing, it can be pollen allergy. And third thing, it can be food allergy. So when it comes to dust allergy, what are the common things we have to be careful about? So people who use carpets, who use blankets, the furry blankets or furry coats, or the children who are using furry toys like those teddy bears and soft toys, the first most important thing is to avoid all these things because it can attract a lot of dust. So when you have carpets, remove them. If you have blankets, furry blankets, you try to enclose them in the quilt covers and zip it off so that the furry part of the blanket is not exposed and you don't sleep with them on you. The third is that all these furry toys and all should be removed from the place. Even air conditioning, so when we use our AC, especially in summer, so if you have not used the AC for a long time and then you switch it on after a long time, all the fomites come out and that causes an allergic reaction. The second thing is the pollen. So many people who are allergic to pollen have a seasonal allergy. Whenever there is a flowering season, they say that their allergic conjunctivitis has increased. And definitely they have to avoid going to gardens and anywhere where there is a lot of pollen basically. Third is whenever anybody at home is dusting. So whenever you are dusting the house, it should not be dry dusting, because whenever you do dry dusting, all the dust comes into the air and then you breathe in that and then you tend to get the allergy. So when children have allergic conjunctivitis, we advise the parents that whenever the dusting and all is going on, let the children go to the next room so that they avoid this. And if the adults are getting allergic conjunctivitis, it's better they wear some protective goggles, they wear a mask and then do this. And rather than doing a dry dusting, you let them just wipe it. So a wet wipe or something which prevents the dust from going into the air. So these things appear to be very, very common, but it's something which we do not pay attention to. And believe me that if these things are taken care, it really helps. One more reason why we see many patients getting this is old books or old clothes. So old clothes, when after a long time, if you have taken out a dress to wear and all and you start sneezing, that means again you are having this dust allergy. The other thing which we have to remember is the food allergy. So some type of food, especially some people are allergic to bananas, some people are allergic to probably some nuts, so, or eggs. So you have to see that when you or when your child eats a particular type of food, on that day they are getting a lot of allergy. It can be itching of the eyes, or it can be sore throat or something. You can relate it that it's because of that food, and that is something which you can prevent. So basically, though eye drops and eye medication and tablets can help you to prevent this allergy and take care of that particular episode, it is very, very important to understand how you can avoid that episode or how you can decrease the frequency of the episodes. So I hope this information was useful, and please share with your friends as well. Thank you.